All right, I'd like to welcome Dan Frey, an Army veteran, co-founder of FieldMed, which is a community health software platform, which sounds pretty cool. Dan, I'm looking forward to talking about that. Before we get to talking about business and entrepreneurship, I'd like to hear what you did when you were in the Army.
Yeah, Joe, absolutely. I got into the military in '89. I started off in the reserves. I just wanted to get some high school education. I wanted to use a GI Bill. So I started in the reserves, and I actually did 6 months as a mechanic. And I absolutely loved it. I came back to my reserve unit, and after about 6 months, I went to my captain and said, "Hey, I've paid y'all back your time. I want to join active." So he was more than happy to released me from reserves, and I went active. I got sent to Fort Campbell. I was in the 101st Airborne there, first of the 187th Rocketsan's infantry unit, and I would go to the motor pool every day and notice that there was more mechanics than there were Humvees because it was a light infantry unit, and got to watch everybody else doing all their fun training. So I actually went to my warrant officer at the motor pool and said, "Hey, man, I would love to do what they're doing." So he spoke with the captain at the 187th, and they went ahead and sent me to infantry school, and I reclassified as 11 Bravo, and I was part of the first of 187th, deployed overseas, Desert Storm, and spent a little over a year there. And then after a total between the reserves and active, just at 5 years, about a month shy of 5 years, my time was out, and it was when they were downsizing the military considerably. So I decided to go ahead and get out and take my time and go ahead and got out. Wasn't sure what I was going to do, which led to a very interesting next year.
Yeah, what happened that first year after you got out?
So I got out, and I'm an adrenaline junkie, and I love the military. I wanted to make a career out of it, and it was just something I'd always wanted to do. And then when I got out, I wasn't ready for that. I wasn't ready to get out, and they didn't have everything in place like they do nowadays for people when they get out. And I just kind of closed my eyes, put my finger on the map, and said, "Hey, I've never been to Chicago," so I went to Chicago and started working construction there. Ended up it was hard because I didn't have the camaraderie that I had in the military. I didn't have the friends there to keep me in check and keep them in check, and I ended up getting in a lot of trouble. I was, in and out, got in a lot of bar fights. Was drinking way too much. Just didn't know what I was doing, and I pretty much just screwed off the next year, and didn't know where I was going, what I was doing. Didn't really even care. Worked construction jobs here and there. And then I met a couple guys at a bar, believe it or not, that were Chicago firefighters, and started hanging around with them. And that's when I decided I wanted to be a firefighter.
Nice.
Uh, yeah. So it actually it turned out pretty good. The military, like I said, was something. I was a troubled kid before I went in, and this was really the only opportunity I had to get some education and get some formal, type of training. So when I went in the military, I definitely grew up from a man. Grew up to become a man. I was a punk kid at best, and the military definitely helped me when I started getting into fire service. If I would have continued down the path, there's not a fire department in the country that would give me a shot. But with the military background, the honorable discharge, and you know all the things that I learned there, especially about teamwork, was absolutely 100% how I got into the fire service, which was the next 25 years of my life.
Oh, no kidding. So you're a firefighter for 25 years. That's awesome.
Yeah, I was a firefighter for 25 years. Over after about 10 years after the military, about 9 years into the fire service, I was diagnosed with PTSD. I was getting in a lot of trouble, had a hard time, as military and fire service often does, keeping a marriage together. Um, Ended up, like I said, being diagnosed with PTSD, and I have a service dog actually from the military that helps me with that. I wanted to do 32 years in the fire service, but after um, 22, I was diagnosed with cancer, contributing to the fire service. So I always joke about, my life choices and careers were fire service and military. I got a service dog and had cancer, but it's in remission. Everything works for a reason. It turned out well. So it's actually spurred me on to where I'm at now in life.
Wow. So as you got away from being a full-time firefighter, what'd you start doing on the business side of things, and ultimately wind up in the field of entrepreneurship?
So when I was in the fire service, I created a program that was uh, mobile integrated health. It's seeing patients at home preemptively instead of waiting for them to call 911. We'd actually go visit them at home and help them with their medical conditions and try to keep them out of the hospital and out of the ambulance service, because these weren't people that had true emergencies. They just weren't sure how to handle themselves. I started that in 2000, end of 2012, with a partner on the ambulance and a doctor. So there was no software for it. And I'd always just write things down on notebook paper, what I wanted to report. I was the one that went before city councils and stuff, and would ask for money, support the program, things like that, because it was just, we were funding it ourselves. After about 5 years of that, um, I decided to start reaching out to people to develop my software. And during that time, about a year before that, is when I got diagnosed with cancer. It was becoming harder to physically do my job as a firefighter,
Mhm.
but I had this idea on the side, and it morphed into, I ended up teaming up with a company called Graphium, which is the second largest anesthesia company. And we teamed up together to form FieldMed, which is EMS, community health software. And it allowed me to retire actually 7 years earlier than I planned on, and which is a good thing, because it was just, my job was physically hard to do at that point.
Mm-hmm.
Yeah.
Yeah. So, explain to me or what the concept of community health is.
Community health is, right now in the country, and it has been for the last few years, there's people that can't afford insurance, or have insurance that just doesn't cover everything that they need. They're either under or uninsured. And then there's people that just, they elderly people that might have been married for 30, 40 years, and the spouse is taking care of them. The spouse passes away and they don't know how to take care of themselves. A lot of these people, what they'll do is they'll call 911, and that ambulance takes them to the hospital, the ER, and they are seen for things that can be seen at a standalone clinic or taken care of on their own, but they do not understand how to take care of themselves, or when it's appropriate to call or not call an ambulance. And then a lot of them just use the hospital as their primary care doctor because of their insurance
Mm-hmm.
not having any, that hospital. And so it causes overcrowding with the 911 system. It causes overcrowding with the hospitals. And then it also costs a lot of money, which raises insurance costs. So the community health side of it is, we take paramedics who are already trained in dealing with people at home, and we see these people. We have scheduled appointments where we go see the people at home, where we'll visit them and we'll train them on their medical condition. We'll train them when it's appropriate to and not to call the hospital. We'll help them get durable goods such as wheelchairs, walkers, get them set up on Meals on Wheels. We'll help them get insurance, how to apply for insurance. So it keeps that overcrowding down, keeps the cost down, and ultimately it creates way better care for the patients, because they're able to take care of themselves in a way before they couldn't, and they would wait till things got bad and then go to the hospital.
Yeah, that sounds like an awesome concept. So, hey, hold that thought. We're going to take a quick break.
Absolutely.
We'll be right back. All right, back talking with Army veteran Dan Frey, co-founder of FieldMed. We're talking about community health. So, Dan, one of the things you said before the break was community health is using paramedics to go see people when more of preventive medicine, almost like preventive maintenance, going in and coaching people that aren't taking care of their health by themselves very well, trying to keep them from calling 911, having an ambulance or paramedics showing up, clogging the ER, that kind of thing. So I'm real curious, is uh, paramedics going out and doing almost house calls with these kinds of folks, is that how does that work as far as good use of their time, and is that like appropriate use of their time? How's that work?
That's actually a great question, Joe. There's we've I've had to answer this question several times, especially in front of the city council. Um, it's a great use of their time, and it's a great use of the resources, because if you look at it in terms of, these people are going to call 911, two paramedics are going out there. They're going to see him in the home. And if the patient wants to go to hospital, ultimately those paramedics have to take that patient to hospital. So now they put him in the ambulance and they take him to the hospital. They do the report. They use whatever equipment in the back of that ambulance, IVs and things like that, and then they get them to the hospital. So if you take the hospital side out of it, just what that paramedic did, the average call is around 45 minutes to an hour by the time they do that. Now you're also taking an ambulance out of service that could be used for someone having a heart attack or a stroke or something more serious that that ambulance is needed on. And you're spending the fuel and the equipment cost, and you're taking those paramedics out of service for about an hour. If you send the community medics out to see these people on scheduled visits, we're usually going in like a crew cab pickup truck. We still fight fires, so we have all our firefighting gear with us, and we have all our medical equipment, but we're not transporting. So we just go in a pickup truck, where that ambulance might cost $400,000 to $500,000 to purchase. That pickup truck is, with all the equipment and everything, maybe $120,000. Our average visit's about 30 minutes as opposed to an hour, and we're not tying up the equipment for someone that might need it more. And we've actually showed, seeing these patients, a 70% reduction in the patients we see of them calling 911, taking those ambulances out of service. So it's actually a great question, and it's a very good use of paramedics in the field. And the paramedics are used to doing things in the field, because the other thing is, we work with the primary care physician of that patient once we get them signed in the program. And there are things that primary care physicians will never know about patients. Patients aren't always, they don't always think about what to talk to the doctor about. And we're seeing things in that patient's home that the doctor may not be able to see. Like, maybe it could be bottles of alcohol on the cabinet, or the food they're eating, or the conditions they live in. We're able to help with their health care and adjust based on certain circumstances like that.
Yeah, and when the paramedics show up out in a pickup truck, are they technically on call in case some emergency call came in, or are they kind of off in a separate category where they're doing house calls?
So yes and no. While they're seeing that patient, it's just like if they were on any other call, they are dedicated to that call. So from the time they check out to see that patient until the time they go back into service, they are seeing that patient and they are dedicated to that patient. In between, they're available for emergency calls. So as long as they're not actively with a patient they're seeing, yes, they're available for emergency calls as well.
Because it seems like, especially in a city like Chicago, big enough that paramedics could spend their whole day doing calls like this. Really, if the work is there, I would imagine.
Yes, they absolutely could. And I'm actually just outside of Dallas now. After about a year, I tried to get on the Chicago Fire Department, and it was hard just because so many people were applying. I came back home. I'm originally from McKinney, Texas, just north of Dallas, and that's where we started this program. When we started this program, there was only a couple other cities out there doing it, and they were mostly private companies. There's about 1,500 nationwide now. Medicare and Medicaid is starting to reimburse for it. Insurance companies are starting to reimburse for it. So it is they've noticed the need, and they've noticed the change in the patient care, and ultimately it helps the insurance companies the most because they're saving the most amount of money. But if you look at it on a patient side, the patients are healthier ultimately and get better, more personalized care.
Yeah, you said something that made me think, if an elderly person who is on Medicare or even Medicaid, if they call 911 and they get an ambulance ride to the ER, does Medicare or Medicaid get billed, the 10 grand for the ambulance ride typically most of the time?
So they will get billed, but they don't always pay. There's a lot of times the way insurance works, especially with this, is if you call today and you go for congestive heart failure, and then you call in a couple more days and go for congestive heart failure again, that hospital gets dinged a little bit of money because Medicare and Medicaid won't fully reimburse because they feel like you haven't taken care of the problem the way it should be. The other thing is, a lot of the people that are calling, and with the elderly population especially, a lot of it's just they're not sure what to go to hospital for. So a lot of times when they get in that ambulance, the ambulance is going to take them regardless of bill pay or not, because most ambulances are run through the city fire department, so the city tax are paying for it. But if that elderly person calls and they go to the hospital and it's something that insurance doesn't deem necessary for an ambulance, then that bill is now on that elderly person, and it's not, insurance won't pay for it.
Mm-hmm. And typically, like from what I've seen, an ambulance drives about 10 grand, right? I mean, that
It
seems
depends. Yeah, it depends on what it is. If it's just a drive, if it's used more so as a taxi, just pick up that patient, drive them. Just bare minimum, that's $1,500
yeah,
just to drive them somewhere, and
yeah.
that's if nothing is done. So yeah, they can definitely get expensive.
And so I guess what I was getting at is if it's typically 1,500 or 10K for a
Yep.
serious ambulance ride, um, it doesn't take a whole lot of
No.
community health care to prevent. If you just prevent one person from taking one ambulance ride every year, then it's more or less paid for itself.
Absolutely. We had in our first year of our program, we had one guy that had racked up a bill in the first. We tracked everybody the year before for 12 months before we see them, and then 12 months after they're out of the program, and then the whole time during the program, obviously. But he had racked up $794,000 with our local hospital in the 12 months before we started seeing him. In the 12 months since, well, in the time since he joined the program, through the program, which I think he was in our program about 9 months, and then the 12 months after, his total bill was just over $1,700.
That's crazy.
So
And
yeah,
um, FieldMed, it's not a nonprofit, right? It's actually a regular
it's
profit.
it's a regular company, and what we actually do is there was no software for reporting this, so I noticed there was no way to track and trend. When I was going to council meetings and when I was talking to people, they were asking for proof of the program, proof of what we're doing. Can you show patients outcomes? Can you show the money you've saved? Well, the true way in healthcare to show money saved, it's kind of strange, because if you keep them out of the hospital, it's not, they don't consider it as money saved. It's just money not spent. So what we had to do is show patient outcomes were improving. There was no way to do it. So when I teamed up with this company, Graphium and formed FieldMed, our goal was to make community health software. Since then, it's actually grown. We have telemedicine now because paramedics for the I've been a paramedic for 25 years or 26 now, and we never had telemedicine. Telemedicine wasn't a thing for paramedics. It was doctors and everybody else. But why not? We're the ones in the people's homes. So now it's getting a lot bigger, especially with COVID. So our company, we also do telemedicine, and then we also have EMS 911. So we do the ambulance side as well. But our company was founded based on that community health software. So yes, we are a for-profit company.
And so another question I have is how is the community health concept? I understand, I get how it incorporates people that are already paramedics and the transportation involved, but how is it differing from like in-home nursing care? Because there's a lot of that, especially among the elderly, where a lot of nurses doing a lot of in-home care, nursing monitoring and that kind of thing, like almost daily or weekly. How does that differ from the paramedic program?
So the way it differs from the paramedic program is we operate 24/7. It's a combination of your EMS 911, your home health, and your doctor's visits. Paramedics in the field are actually able to do more than nurses are allowed to do. Nurses have their protocols and they're trained to work in a clinic, in a hospital, places like that, that are directly under doctor's supervision. So they have their set of protocols. Paramedics are trained to work out in the field. So we're autonomous from everybody else. We work by ourselves. And if that doctor's Texas is the best example of this. If a doctor says a paramedic can do it in the field, we can do it. We can intubate patients. There's so many things we can do that nurses aren't able or allowed to do. The other thing is you can pay paramedics less. I hate to say that because I'm a paramedic, but it actually saves money because you can pay us less. So the program works better financially for a lot of doctors and hospitals because you can pay a paramedic less. Now, there are programs out there that do run with nurses. Some run with PAs and things like that. There's a lot of programs out there that there is no national standard right now for community health. I actually sit on a committee that is coming up with the compliance for community health nationwide, but right now there is none. We're working on it. So for as many programs out there, there's that many different ways to do it. But the short answer for your question is paramedics are able to do more in the field than nurses. And we are used to seeing people in the field where others don't. And one of the big things we do is home safety evaluations, which they don't do the same kind of home safety evaluation as we do.
Mm-hmm. Now, most of the paramedics that are working for your company, are they already employed with a local fire department or some local city agency like that? Or are they exclusively working for your company? How are you integrating that with the current local services?
Well, so our company is just a software company. So we just provide the software for it. Now, I do consult with several cities around that are starting up their programs. And that's one of the things that I do just because I believe in community health and how important it is. Obviously, ultimately, I'd love everybody that starts a program get our software, but I consult with them for free. I don't charge anything. If a city wants it, I'm consulting with one in Del Rio right now, a private company, to help them start community health programs. And I do that because I love community health and I think it's important to give back. So I do that. Hopefully they use our software. If they don't, I don't care. I'm still going to consult with them, even if they're using someone else's.
And what's the primarily what does your software system do? Is it mostly expense and savings tracking, or does it integrate the whole process?
In the whole process, when you have your healthcare software, like if you were to take an ambulance ride, which is something most people would understand a little more, is from the time you call 911, there's a report started on that patient, and dispatch puts in their notes, and then those notes are pushed over into the software that the paramedics report on. They show up, and it takes all the patient's demographics, their addresses, and everything, and then the paramedics will write and trend and track everything that they do in that report, and then at the end they hand it off to the hospital so they know it was done, and then they send it off to a company to bill for. That's what our software does on the community health side. The difference is we do trending and tracking. So we will trend the patient's use. We have graphs where we trend patients' healthcare because in the community health model, you see patients time and time again depends on what the issue is. It could be a month, it could be a year. And that whole time we will trend and track everything with graphs. You can pull up all their reports. So it's just software that captures everything that's been done for that patient while they've been in your program to show improvement and to help you come up with care plans to adjust what you're doing for that patient.
Interesting. And you were starting to work on this program while you were still a firefighter?
I would just, I took a notebook and I would just write things down, write it down in notebook, write it down in notebook. And, it's funny. So this is what I would love to say to everybody out there. From the military up through the fire service, I learned you don't quit. You just believe in yourself and believe in what you're doing and work hard at it. I love the community health program. I didn't make any more money. I ran more hours than any other fire department in the city or firefighter in the city, but I loved what I did and I believed in it. And I kept doing it. And I would write all this stuff down. I searched for a while for a software company, and I heard everything from it's going to cost $2 million to $5 million to crazy numbers to get this going, to get this developed. But I knew what I wanted to see, and I knew it was the right thing. And I kept reaching out to people, and then I found this company that believed in what we were doing, and an investor that believed in helping people the same way I did, and they gave it a shot. And after 5 years of writing stuff on notebook paper, I designed it all, came up with it in my head, came up with the idea how I want to do. I know almost nothing about software. I know a lot more now than I did, when I started this year and a half ago.
Yeah.
But I found the right people. I found people that believed in what I was doing, and I just kept going. And I knew I had to do something to get this going, or just give up. And I didn't want to give up on it.
And that's a really great point, especially a lot of folks getting out of the military spouses,
Yeah.
they may have an idea for a software system and they think, well, I'm going to need to become really good at writing software in order to do this. And the fact is you don't. What you knew was the process, the manual process that all of this that was involved in all of this. And you just wrote down the processes. And so you kind of turned over your raw notes to programmers, developers, coders. And then when they gave you back, you just went through and, gave them feedback saying, no, fix this, fix this, fix this, fix this. That's basically the process.
Yeah. Basically it. I knew how to make PowerPoints. I made a very crude PowerPoint on what I thought I wanted to see. And I presented it before these people. And these guys, I mean, half of them worked for Adobe for 10, 15 plus years. They've had their own companies. And I'm presenting this before them with a PowerPoint. And I know inside they're laughing, but they were able to see what I wanted. And I would say on the software side, if you're looking for somebody to develop your software, getting it developed is very, very expensive, but it's not even half of the process. Marketing it, selling it, find the people. That's hard. My suggestion would be find a partner that wants to do it with you, that knows the ropes. Because if I did not have this Graphium that already had software out there, and they didn't come and say, I want to buy your company, or I want to buy it from you. They wanted to partner up. So I formed an LLC, and they already had theirs, and we came up with this third company. If you can find someone that will partner with you and walk you through it, that's honestly, that would be my best advice, because I did not know what I did not know. And I thought I wanted somebody to develop so I can go sell it. It would have failed the first month.
Yeah. A few episodes back, I interviewed Dan from my mastermind group, actually, and he owns a software development company. That's one of the things he said was on advice on if somebody's got an idea for a software program or an app. The first thing he said was clearly define how it is you're going to market it and sell it first. How are you going to do that? And if you've got a really good plan for that, then go back and consider developing the application. But otherwise, because it's just not going to sell itself.
It does. It absolutely is not going to sell itself. And if you know the audience and you know what you're talking about, then you'll get somebody to listen to you. I actually, when I was going through these guys, it was like a mini Shark Tank. They would set up a meeting every Monday, and they wanted to know my development plan. They want to know my sales plan. They want to know my business plan, marketing, so on and so on. You know what I would do? This is no joke. I was a firefighter. I was military and firefighter. That's what I knew. I'm a paramedic. I like to think I'm a good one. I have no clue about business or any of this. They would say, we're having a meeting next Monday. So that week, I would back watch every episode of Shark Tank I could. That's exactly what I did. And I would make a business plan. I would make a business plan based on what I thought they wanted to hear, based on what I heard on Shark Tank. Same with my sales plan, everything. I would watch Shark Tank over and over and over, knowing the questions that killed these people. And then I would just take notes on it, and I would come up with something, and I'd have a meeting. And I know they knew that I had no clue what I was talking about, but they also knew that I was trying very hard, and I was willing to put everything I had into it. And that's what they liked. They knew I wasn't just going to go, hey, I got the software deal, I'm walking away. I still work 12, 14 hours a day, and I love it. I'm not an office person. I'm still an adrenaline junkie. It's hard, but it is what it is. You got to do what you got to do.
That's awesome. We love Shark Tank. I mean, you can learn so much from it. As a matter of fact, like you get so good at watching Shark Tank when sometimes these people show up and they're like, you're like, why are you even on the show? What do you mean you don't have any sales yet?
Yeah, it's funny.
That's where they're coming from.
The one thing, my pet peeve on Shark Tank is when somebody says, or like Mark Cuban, I want 51% of your business. That guy's like, oh, you know what? I can't do 49. He goes, I'll give you 49. I want 51. I'm like, really? It's that whole, you've got someone that's going to take this to the next level, and your 49% of 10 million is going to be way bigger than your 51% of $500. It's just, they don't think about it.
Yeah, I know. Or sometimes they even argue of less percentage than that. Like, oh, I can't give up 15%. Yeah. You think you can go 12 and a half? It's like, and people walk away from them, people walk away from the deals, which is crazy. Like I almost would not I mean, I would almost, if I ever found myself on Shark Tank, I'd be like, I got to walk out of here with a deal, because otherwise, what's the point of being on the show? I
I
mean,
agree. And another really big piece of advice I've learned over the last year that I would love to tell people, and I've learned this through my business partners and through this process, is if you do end up in a spot where they say, hey, we want 60%, we'll give, think about it as, okay, like I just said, this much percentage of this is worth way more than a percentage of a few hundred. But usually entrepreneurs, and when you're doing this, the first time you do something like this, like the software or something else, it's not, it's the start of your entrepreneurship. It's the start of where you're going in life. This isn't, more than likely is not going to be the only product, the only thing you ever do. I've already got other people that I've met through doing this that are wanting to do business deals, that are wanting to reach out and grow. And if I, because I don't have 50% of the company, I had to get an investor. So we went 50-50, but then I had to get an investor on my end. I still have a huge majority of the company, um, but I have other opportunities. You've got to get to a certain point to where you can grow things for yourself. And if you pass up that first deal because you're worried about 5 or 10%, you'll never get to that next level to do it.
yeah, I mean, that's a great point. Obviously, you always want to hold on as much equity as you possibly can,
Oh
but
yeah,
you
absolutely.
never know where it's going to go. But the thing about entrepreneurship is entrepreneurship is a process, and if it's not a one and done, I'm gonna create one company, it's gonna go huge, and I'm gonna retire as a billionaire.
Right.
It's a process, and so you have to learn the entrepreneurial process, and sometimes you learn it. You run several ideas through your process, and everything fails. Then you grab
Yep.
the next idea and run it through that process. And once you've got one that's become successful, even if you ended up with not as much equity as you liked, um, now you've got a really clearly
Right.
defined process, and you just keep running ideas through that process. And so that's a great way of looking at things. It's not entrepreneurship's not a one and done thing, especially if it's your
No, no.
first venture and you've gotten that far to the point where investors are coming in. I mean,
Yeah.
it's only the beginning.
Exactly. It's only the beginning, and you need to, I looked at when I started this, what percentage am I going to need to make more than I did as a firefighter? And I was like, I'll be happy with that. But yeah, so it's a process, but it's a fun process. It's scary. Between 5 years in the military and 25 years in fire service, I had a steady paycheck every 2 weeks coming in. Didn't have to worry about it. Fire department wasn't collapsing. Military wasn't going away. I was good. When you take that stuff out on your own, it's a very scary. I have kids. I have house
Yeah,
payment, car payment. It's very scary, and that fear does not go away, but it keeps you going. It keeps you pushing hard.
absolutely. Well, hey,
Yeah.
Dan, if somebody's interested in finding out more information on FieldMed, how do they find you?
Our website, www.fieldmed, FIELDMED.com.
Awesome. I appreciate that. And also, if you're talking to somebody in the military on their way out, somebody that just got out trying to get into the world of entrepreneurship, what kind of advice would you have for them?
I would say do not give up. Do not get discouraged. You're going to I had the door slammed in my face more times than I had it opened. Do not give up. Same thing the military teach you. You can't quit. Just believe in yourself, believe in where you're going, and keep going at it. You're gonna find that right ear that's gonna listen to you and work with you. You just got to keep going until you find them, and eventually it's gonna happen.
Awesome. Well, hey, Dan, appreciate you sharing your entrepreneurial success story. And, it sounds like with FieldMed, you're actually, you guys are pretty young and lean. We look forward to big and future success.
So do I. Thank you, Joe.
All right. All right. These two veterans are Oscar Mike.